Hello, and welcome to this PCC learning resource designed for practices who are implementing or thinking about implementing GP CPCS. Just to start and remind ourselves that the aim of GP CPCS is to help create some additional capacity and reduce the practice on GP appointments by offering patients that are suitable for the service a referral to a participating community pharmacy. The aim of the service is to identify ways that patients can self-manage minor illnesses with the help of pharmacists in the community. And today, we're looking at influencing skills and thinking about how you can build on and develop your own personal powers of persuasion. So what is influence? What is it? Influencing is helping people to change their minds or influence the way they do things, influence things that they think about. And persuasion, the ways in which we do that, is one of the tools that we have to influence other people. And why are influencing skills so important? Because the way we explain how the service works and what benefits are to patients matters. And what we want to do is we want to be able to navigate as many patients who are appropriate for the service as possible, relieve the pressure on GP appointments, and make sure that GP appointments are available for people who need them. So let's start by thinking about who influences us. Is it our friends and family? Is it our colleagues? Is it social media? Is it health and other professionals? Is it the GPs that you work with, the clinical staff you work with, your own GP? Is it things we watch or read? Who else? Who or what else influences you? And think about for a moment what it is and why and how they influence you. Is it their powers of persuasion? Do they give you information? Do they know you and you trust them and like them, so you trust their advice? Do they listen really carefully to what you say and then try and understand your point of view before putting another point of view across? Do they offer you a different perspective? So spend a moment right now and just think about how you get persuaded. What makes you change your mind? What makes you say yes to doing something? What makes you more likely to try something new? Because understanding what works for you will help you understand what might work for the patients you want to offer this service to. We spend our lives communicating, and how we communicate with people is an important tool when it comes to influencing. When we talk to patients about the service, the words that we use are really, really important. For example, did you know that pharmacists are highly trained healthcare professionals who have 5 years training and who spend a lot of their time helping people to manage a range of minor ailments? Did you know that the service offers a same day, or in some cases a next day, appointment? And did you know that in many cases patients' needs are met over the phone during a telephone consultation that will feel very familiar to them, because that consultation will be private, and during that consultation they will be asked about their medical illnesses, their medical history, their symptoms and their current medication. So for many patients, it feels very familiar. And for many patients, it is a chance to be seen much more quickly than if they wait for a routine GP appointment. And that's one of the key tools to think about, is how you explain to patients what this is all about. That idea that this is a same day or next day appointment, as opposed to waiting maybe several days or even a couple of weeks for the next available routine GP appointment. And as we're thinking about how we explain this to patients, we need to think about what communication means. And I'm sure many of you will have heard about verbal and non-verbal communication, but why is it important? What does it mean? And what it really means is that our communication is not just about the words we say, how we say it too. So the words we use are really important. And in the context of GP CPS, explaining as simply and as clearly and as concisely as possible what the service is and what it offers to patients is really important. The tone of your voice and your expressiveness matters too. Are you listening to people? Are you sounding engaged? Do you feel that you're making a connection with them? Do you feel you're building some rapport, even in those briefest of telephone calls? And body language, which really is 55% of the way we communicate, helps people understand and make sense of what you're saying. And to be an effective communicator, which is a really important skill for influencing, it's important that we complement the words we use with the appropriate voice tone, facial expressions, and body language. And given that many of your conversations with patients will take place over the phone, how can you use your words and your tone and expressiveness to help patients say yes to a GP CPCS referral? Some of it is about speaking with confidence. And to do that, you've got to make sure you know how the service works and you know how you can explain how the service works to colleagues and patients. And then thinking about how we use our voices. How can we make best use of our voice on the telephone? So think about the pitch of your voice. Do you have a very high pitched voice or a very low pitched voice? What's your voice sound like? How fast do you talk? The average talking speed is around about 140 words a minute. And sometimes when we're really busy, we try and talk really quickly in order to speed things up. And actually, that often can result in people telling us the information again, because we hear people talking quickly as being too busy to listen to us. Clarity, just so that you're not mumbling or stumbling over your words, and making sure that the words you are using are as understood as they possibly can be. And tone, again, the expressiveness in your voice. Remember, when tone makes up a third of the way people understand what you're saying to them, it's really important. How do you make your voice sound warm, compassionate, caring, and confident? What do you need to do to help your voice tone be as successful a tool to influence others as you can be? Some top tips for influencing people. And listening, absolutely listen. And this is something we do all the time, is listen and really understand and show people that you've understood. For example, you can use words like, based on what you've just told me, and you can tell them the symptoms that they've explained to you, I think you are an ideal person to have an appointment today with our pharmacist. And you can then tell them how that works, whether the pharmacist rings them or how it works for you in your practice and your PCN. Think about how you can explain how the transfer of the referral works. Can you avoid using really technical jargon and NHS speak? And can you talk about the opportunity to have a same-day appointment with a pharmacist who is an expert in minor ailments? Because what you are doing there is you are helping to really reassure patients that they are going to see somebody that is the best person for them to see today. Smile. People can really hear you smile on the telephone. And try it. If you haven't, then do. It really does work. People can absolutely hear you smiling. Express empathy and be kind. Remember, people are ill. And remember that this is a new service and people may be a little hesitant. So with your help and your confident, kind, empathetic approach, you can help them make a decision about a referral to a pharmacist being the best service for them today. Be clear about who the service is for. So, who is suitable for this? And here's a really good flowchart from NHS England that explains who is suitable for the service and why. Make sure that you understand the whole referral process. Are there days or times, for example, when your participating pharmacists aren't open at the same time the practice is? Are there a certain number of patients that the pharmacist can see in a day? And how do you reassure patients who might be anxious that they won't be able to see a doctor if they need to? How does that referral come back into practice? How does that patient know that they're going to be seen if their appointment is more urgent? Think about how you are going to explain all of this to patients and think about how it works for your practice and your PCN. And think about and plan answers for the questions that patients might ask. Think about those patients who will say, actually, I don't want to see a pharmacist. Then what you can say is, that's okay. I will make you a routine appointment to see a GP. And our next available slot is that in a few days or is it slightly longer? And then you can follow it up with something like, however, you could talk to the pharmacist today. They will be able to help you. And they're a highly trained healthcare professional who is part of our practice team and based in the community. Reassure patients that if the pharmacist feels they need to see the GP, they will make sure that they get a GP appointment. And how does that happen? How are you going to make that happen in your practice so that the patient does not have to kind of go back and ring through? And there we've got some things on the screen for you to think about that you might want to talk to colleagues about as part of the implementation of the service. If you are refreshing the service or you are just starting to implement it, it's a really good idea to be able to tell people about it. And patients are much more likely to say yes to a referral if they have heard about the service in the first place. Have you got a message on your website about it? Have you got a poster up in reception about it? Have you talked to your patient group about it? Have you put posters up in community organisations? Do people in practice know about it? Can they tell people about it? And start thinking about how everybody can become aware that the practice is engaging in the service. And think about how you talk to people about it. How are you going to explain it to people? That's a very, very quick overview of some ideas for how you might use your influencing skills and your powers of persuasion to help people say yes to a GP CPCS referral. What happens next is down to you. How are you going to share some of the ideas from this video about language, about communication, about a plan in place for telling people that the service happens, about making sure everybody on reception and care navigation knows how the service works and feels confident to explain it to patients? How are you going to use the advantages of that same day or next day appointment to help patients say yes to your referral? How are you going to keep and manage your resilience when several people on the trot say no thank you? How are you going to carry on and find the energy to ask the next 5 people? And remember, this is only suitable for those 6 to 8% of your patient group who ring in wanting to see the GP with a minor ailment. It's not a service that is suitable for everybody, but of that 6 to 8% of patients who are suitable for the service, how many would that be for you to save the equivalent of a GP list every week? Could you see yourself signposting 16, 20, 25 patients to this service and seeing the benefits of those released GP appointments and being able to offer GP appointments to those patients who need it most? So think about how you can get your plan in place, think about the language you use, and make sure that as a team of colleagues, you're all supporting each other and you're all learning from each other about what works. There are lots and lots of resources that are available to help you. So you can use either PCC's website and NHS networks, and you can use the NHS Future Forum. So think about what we've talked about today. Think about where you can start in your practice. Think about your language and use your influencing skills to good effect.